Everyone, I'm Dr. Marilisa Galarraga, and I am super happy to present the main outcomes of the systematic review and meta-analysis evaluating the prevalence, incidence, systemic, behavioral, and patient-related risk indicators for peri-implant diseases, which was developed for the Academy of Osseointegration and American Academy of Periodontology consensus. So in this systematic review, I was extremely happy to be the leader to guide my co-authors to actually find what is the prevalence of peri-implant diseases. So we know currently that biological complications around dental implants are a major concern for in the clinical practice, especially when we have to understand if the success of implant therapy is actually happening, because we know this might be the occurrence of peri-implant diseases might be a main outcome of the main. This systematic review was extremely wide, so we understand that we included 102 studies which evaluated around 13,000 patients with 40,000 implants. And out of these, we can actually conclude that it is very important that we understand the epidemiology of peri-implant diseases to actually mitigate the prevalence. In this systematic review, we actually determined with the weighted mean values that the prevalence of peri-implant mucositis was around 46%, while the prevalence of peri-implantitis was around 21%. Both percentages are extremely high and show how important it is to prevent peri-implant diseases, but also how we can actually, if we diagnose them, try to stop them on time, because we know peri-implant diseases follow a non-linear accelerated pattern. With this, actually, this systematic review also determined through prospective and longitudinal studies that the incidence of peri-implant diseases after 20 years of follow-up was 53% for peri-implant mucositis and 22% for peri-implantitis, which also shows that 1 out of 5 patients will be diagnosed with peri-implantitis after 20 years of function. The systematic review also determined that around 50% of the implants will present either mucositis or peri-implantitis after 10 years of function, showing a strong correlation with time and the prevalence of diseases. When we evaluated the main risk indicators, we determined that both periodontitis and smoking habits were the main risk indicators that were statistically significant with both peri-implant mucositis and peri-implantitis, while obesity was determined to be a main risk indicator for peri-implant mucositis, and then diabetes mellitus and alcohol consumption were both associated with the prevalence of peri-implantitis. Still, we don't have enough evidence to determine that other factors such as cardiovascular diseases and other related aspects such as hypertension are correlated with both peri-implant biological complications. Implications for practice and future research might involve that we need to understand and develop strategies to mitigate peri-implant diseases occurrence and progression, and this should center on interventions that can actually target modifiable systemic risk factors and improve in this way the risk profiles of our patients, and in this way decrease the prevalence of peri-implant diseases. Patients should really be instructed about the importance of controlling systemic conditions. Periodontitis, which we know is the main risk indicator and possible risk factor for peri-implant diseases, and also patients should be instructed to control detrimental habits such as smoking and alcohol consumption that we know they can influence the prevalence of peri-implant diseases. Future epidemiological studies should explore the impact of these conditions to actually understand if they are true risk factors for peri-implant diseases, because nowadays still we don't have enough evidence to determine risk factors. We could only determine risk indicators because we have mostly cross-sectional studies with evidence that only can determine this. So With this, I would like to highlight the importance of understanding the etiology of peri-implant diseases, because we should not center on the treatment, but we should definitely center on the prevention on both entities, which affect our patients in a very high and prevalent way. So I strongly recommend you to read this systematic review, which brings very important evidence, and not only this systematic review, but also all the systematic reviews that are included in this very important consensus developed by the group of experts of the American Academy of Periodontology and Academy of Osseointegration. This was a lot of hard work to actually find better ways to prevent and treat peri-implant diseases. All the papers are available online, and it was my pleasure to have this time with you in this promotional video.